Well, happy, beautiful, amazing day. Dr. Bob Rakowski here, wellness transformation expert here with Dr. Johanna Kaplan, who is an anxiety specialist. And we're going to talk about anxiety. We're going to talk about cognitive behavioral therapy. We might even talk a little bit about traumatic brain injury because, interesting enough, your husband is connected to the NFL, and we certainly know that they have gotten a lot of press over the last years about traumatic brain, and hopefully they're stepping that up. But happy, beautiful day. What's the first words you want to share with our audience today about our brain and why it's important to take care of it?
Our brain is our most important organ. We cannot get a brain transplant. And I think it's really unfortunate, just in terms of what I do as a clinical psychologist, that we really have a stigma attached to any disorders associated with the brain as opposed to the peripheral body, and not the central nervous system. And I would really like to kind of get that message out there that it is equivalent, is equal to dealing with any other bodily based disorder.
I like that as a starting point. So, should we get into the why? Why do you think there is such a stigma associated with it?
I mean, this comes all the way from, the process of institutionalization and deinstitutionalization that happened, in the 19 all the way to, like, the 1920s, 1910s, all the way up to, like, the 1960s. Deinstitutionalization really didn't actually stop taking effect until, like, the mid-90s, so we're not that far away from where things used to be, and unfortunately, I mean, treatments for things like panic attack, for anxiety, regular run-of-the-mill anxiety for depression was removing part of the brain. I did my postdoc at the institution where the Kennedy sister and daughter had actually had part of her brain removed. And that was the treatment for mental illness. So I think while we have some really cutting edge treatments that are available for the majority of disorders, we still have a long ways to go. And that is really represented in society, and society kind of sees, anxiety is just something you can get over. I actually had a good friend of mine the other day say to me, um, I think people who are suicidal are just selfish. And I'm like, there's so many places for me to start with that. And it's really, I didn't take it, she's a very intelligent person, and I didn't take it personally. I just thought she's a good representation of how far we have to come as a society and really understanding the brain, and understanding where someone's at when they are suicidal, and that it's not a representation that they take life for granted. In fact, they want a good life more than probably any of us even can grasp or acknowledge. So I think we just have a long ways to go, and a lot of, like, movie stars and people like that are trying to kind of bring out the word and kind of demystify, destigmatize mental illness, but we still have a long ways to go.
So, let's go with some basic definitions. What is anxiety, and what are some of the common causes or triggers?
I mean, it's a great question. I like to talk about anxiety exists on a spectrum. So, like, I could be more functional with a higher level of anxiety than you, and it works for me. And it's not necessarily problematic, or doesn't need to necessarily be pathologized. So what we talk about is when anxiety gets, and I'm going to define it in just a little bit, but when anxiety gets to be too much, occurring too frequently, and we're saying maybe more days than not in your life, and or it is so severe that, like, you cannot, maybe within a few hours, you're just not able to kind of let it go. It's still lingering around. It's still really problematic for your life. That's at the point where it reaches clinical anxiety, um, problematic anxiety. So I always, as a cognitive behavioral therapist, which is an evidence-based treatment provider, for anxiety, what we do is we like to take our qualitative experiences and make them quantitative as best we can. So I always tell patients, like, think of your anxiety on a scale of 0 to 10. 0 is bored. It's not relaxed. We actually know that we can feel relaxed and anxious at the same time. Being bored and anxious is pretty impossible, though. So I say, think of 0 to 2.9 as functional anxiety. Think of 3 is that point where you hit clinical anxiety. So 3 to 5 would be mild, 5 to 7 moderate, 7 to 9 severe, 10 panic attack zone, extremely severe. And think of the 0 to 3 zone where probably most of us exist. Is kind of like, I had a little anxiety getting up and getting ready for work this morning. I had to like get on my computer and make sure I scheduled this on time, or if I missed this appointment, this was going to happen. That's kind of functional anxiety. It gets us to be productive throughout our day. And where anxiety came from is it's kind of a misfiring of our basic biological systems that have gone haywire because it is not appropriate for the place or the time that we're in. So think back, to when we were cavemen, right? And you hear a rustling in the bushes. And what your body has to do is it has to prepare to fight, right? Or flight. So our body is pre-wired to do all of these things, which actually mimic panic symptoms in situations where we're confronted with a legitimate, dangerous stimulus, like a saber-tooth tiger. So what symptoms might that, cavemen might have had? Their heart might have been racing, they might have been sweating, right? They might have been breathing fast. All these symptoms that you'll notice really mimic panic attacks, really mimic anxiety. But it's functional for them because it helps them survive. So I always when I do talks, I always talk about, um, how does the symptom of sweating help us survive? What do you think?
Well, I guess it'd make us slippery if someone's trying to grab us.
You got it. You got it. Exactly. So if saber tooth comes up to you and grabs you, they're going to be more likely to slip off. A common symptom that I see in adults who have anxiety is they will have changes in their eyesight. Why do you think they have changes in their eyesight? Think about like the caveman dawn or dusk.
Well, I tend to think that our vision gets more narrow under stress, right? We tend to be more focused in central vision rather than peripheral. But I think there'd be a pro and a con to that. You may be able to focus on what's in front of us, but we might not be able to see what's coming from the side. So,
You're getting so technical. It's so much easier. So our eyes dilate. It brings in more light because we're not used to artificial light, right? Back then it was dawn or dusk. You've got to bring in the light. You bring in more light, you can see better. You can see what's threatening your life. You can run or you can fight. Um, and this is one that I get for kids all the time. This is where you do have to think a little bit more technical is how does because the kids, their top symptom of anxiety is stomach aches and headaches, particularly stomach aches. So, how does having a stomach ache, if you are a caveman and a saber-tooth tiger is coming out to get you, how does having a stomach ache increase your chances for survival? This is a really hard one. Nobody ever gets this one.
well, I'm going to think of two different things, right? If we're focused on hunger, that's what we're focused on, and so we can't be distracted, focused on hunger. But as one of my professors talked about, sometimes people are going to have a bowel movement and it lightens your weight by a pound or so, and maybe that lightens you just enough to get away. So those are the two things I'm going to say.
They get too complicated, right? The answer that I get a lot from kids and adults is they say to me, "Oh, well, if I vomit or if I, soil myself, it'll make me less appetizing." And I say, how many of you have a dog and how many of them eaten their own vomit? And they go, like, doesn't make you less appetizing. So what happens is any food that you have in your stomach is left undigested because the blood is diverting to your extremities to fight or to run away. And it doesn't need to say, wait a minute, I've got to like digest this, hamburger. It says I've got to shut down my stomach and divert it to the places that need it. My heart needs it. My arms and my legs need it to fight or flight. And that's why you end up with a stomach ache because now the blood isn't going into your intestines to help you contract and digest your food. And so it leaves you with this kind of upset stomach feeling. So that's just it's a more elongated definition, but that's just the definition that we work with when it comes to anxiety is these are symptoms that your body has that you'll have in situations where there's not a saber-tooth tiger. You may just be sitting at school one day or you may just be sitting in your office and all of a sudden you feel like this. There may not be a specific trigger or a reason, and that's when anxiety can either kind of really get really severe, or it can get so frequent that it starts to really interrupt like our daily life. We're not able to focus. We're not able to complete tasks like we usually would. We're not able to get to places on time, or we start to avoid. One of the biggest things in my profession is we always say avoidance equals anxiety. Anytime someone says, "I don't have anxiety, I just avoid," nope, that means anxiety. Avoidance equals anxiety. So it's a good thing to think about. You're probably already in that clinical zone once you're avoiding.
Now, you like to focus on illness related anxiety. So let's talk about that.
I have a book out about it right now. We actually we work with so many disorders. We work with the kind of spectrum of anxiety disorders at my practice: OCD, obsessive compulsive disorder, panic disorder, generalized anxiety disorder, specific phobia, um, major depression, all of those things. But yes, recently I just it's out on Amazon, so I published a book with a co-author of mine, Dr. Warden, on illness anxiety, and so that really took birth or took flight during COVID when we were seeing a lot of people develop anxiety related to their physical symptoms, things that they may or may not be experiencing, giving validity to their experience while also really tearing apart what pieces are anxiety. Because I think a lot of times people will go to a doctor and they're having very legitimate symptoms, and the doctor will say, okay, it's just in your head, go see a psychologist. And we don't even like to take that approach. I think that's very invalidating for someone because there is this brain body connection, and what you experience in your brain and what you're experiencing in your body and vice versa is affecting the other one. So, I mean, I can show you, like, we take like galvanic skin responses, things like that. Your body temperature will change, your heart rate will change, your blood pressure will change, all when you're experiencing panic attacks. So it's not like it's just in your head, it's happening in your body too. And so it's very important to experience validation from your treatment provider, but also for them to say, okay, like, where do we need to kind of draw this hypothetical line? At which point is you thinking about, you have cancer all over your body, helpful for you versus not, like, where can you really draw that line for you in terms of what's helpful? And where can we say, yeah, let's look into this. Let's see what's actually going on. Let's get you an appointment with the doctor, because it's really hard to kind of trust yourself when you have anxiety in the picture about making your own medical decisions.
How do you help people make that bridge? I mean, I guess they're reaching out to you, but there's probably a lot of people that are suffering in silence.
Uh, There are a lot of people that are suffering in silence. But I think the biggest, if I could do the number one thing in this field, I would actually try to get through to and talk to as many MDs and DOs and physicians as possible, and really try to give them the understanding that telling patients like, oh, it's just in your head, there's nothing wrong with you, isn't the best approach. Um, and for them to really say, like, medicine, just like my field, has its limitations. In 20 years, we may have a diagnosis for something that we don't now. It doesn't mean that you are actually experiencing something. So that being number one, and number two being, I really want them to understand that there is an interplay between emotions, specifically anxiety, and physical sensations. And disorders that you may have, whether it's like fibromyalgia, whether it's dementia, whether it's cancer, like, there's interactions between these diseases and anxiety. On that, we can't ignore that either. And so what we do is we kind of take a very specific, um, individualistic approach, and we look at doing what's called like a functional analysis with each of our patients. We want to see what are the antecedents, the behaviors, the consequences as a result of their worries or concerns, and then also checking in with their doctors and so on. So, and for us to ask the questions that we think are necessary to ask as well. My experience in the medical field is that we don't really have people who are very holistic. We don't look at the big picture. And so they're really like focused on their specific specialty. And I think it's really important to get somebody who's looking at the whole picture.
Speaking of, you've got something called a life prep program. So what's that all about and how did that come about?
So that's my new baby. I've been working on this for 3.5, 4 years. So it's a book that will be coming out soon. It's also a current program that we have. And it really is about not just retroactively addressing the failure to launch issue, but it's really about proactively, as parents, even as teenagers, even as early 20-year-olds, how we can address increasing and giving ourselves the psychological skills to be resilient when it comes to getting into the workplace and being successful. And what that was birthed from really 15, 20 years of me being clinically and very personally and professionally frustrated with hearing so many of my patients who had fallen into that failure to launch category not launching. And then I would say to them, did anyone ever teach you like really the value of like resiliency skills? Did they teach you the value of, executive functioning skills, organization skills, attention skills? And these are not just you learn them in 30 minutes and you're done. These are very complicated skills. And they would say, no, no one's ever talked to me about that. And what I noticed was schools were thinking parents were doing this, and parents were thinking schools were doing this, and nobody was doing this. And so the rates now, before COVID, at the beginning of COVID, it was about 45% of ages 18 through 35 in the US that were not launching. And when I say launching, they were not getting independent, gainful employment where they were leaving their original caretaker's house, their parents' house, grandparents' house, you name it. Um, and we're not kind of standing on their own 2 feet. There's many different stages of launching, but they weren't like these are people who were completely not launching. And then now the rates are about 55 to 60%. I've actually been really surprised that like the government hasn't, considered this like a crisis, because this is going to financially affect the US economy. And you're talking maybe 5, 10, 15 years. I mean, very quickly. And we're not really doing anything to address it. A lot of parents think that, oh, my kid does well in school, they're going to a good college, they're fine. And it's actually those kids, a lot of times, like it doesn't matter if they'd had pre-existing anxiety, depression, or if they haven't done well in school. It's really skills that are so separate. I've worked with many valedictorians who've gone off to Ivy League schools who haven't been able to launch. And they don't really have the distress tolerance skills to be able to kind of get negative feedback at work, or to not always get positive feedback. And these are some skills that just I think that, in older generations were taught in classes like woodworking or cooking class. And you wouldn't necessarily think, oh, I need to learn how to cook. But you would think, okay, if I messed up my dish here, oof, that was frustrating. I've got to do it again this way. And the only person who's at fault is me, and I'll take responsibility. So it's like it's those secondary psychosocial aspects that really help to build that resiliency that's missing in these generations, and it's quite concerning. So I developed an individual program that you could take. It's 8 weeks, and I have narrated the entire program, and so you can take it directly with me. It's pre-recorded. And then I also have a program that's very, very intensive that schools can purchase if they want, like high schools, middle schools can purchase, and then have like their health teacher run it. And it teaches these exact skills. So really to kind of get like these kids, these young adults up and running to be not just functional members of society, but also like I want their hopes and dreams to come true. I want them to be realistic. I want them to be able to actually work towards them. So, that's kind of a summation of the program.
You've probably identified something very, very significant there. And, when you were saying high school, middle school, why not even grade school? You know, I don't know that it's ever too early to start getting ready to have
It's
a
not.
successful life.
It's not. What I try to do is I try to gear it towards um, developmentally, like what is appropriate in terms of years. But you're right, you can never start too young. But like I know I have a son who just turned 10, and my daughter's 13, and my daughter would have been ready for this program at like age 5. My son, who's 10, is still not ready for this program. So like it really depends on your kid's level of maturity, their ability to kind of handle emotional intelligence, things like that. So, I mean, it's something that definitely can be used in younger populations, but I think 13 is kind of where the kids start to, in terms of like gender wise, even out a bit in terms of like biological differences, maturity wise, and that they're ready to kind of take out on this information. But again, if parents are like, no, my kid's really like advanced in this area, go for it. Like you have my blessing and a half. In fact, one of the videos that I use when I give presentations on this is my son I think he's at a year and a half. He's like 18 months. He just learned how to walk, and he's putting in, dirty laundry into the washer. And my son's giving him, positive reinforcement. And it's like, yeah, like, cause we have kids who go off, kids, right, who go off to college and they don't know how to do their own laundry. And the parents tell me all the time, they go, well, they're too young. I'm like, here's my 18-month-old. They're doing it. You could do it. Yeah.
That reminds me, I love listening to Jordan Peterson, and he says, in all his years of clinical psychology, never once did he have a patient say to him, "My parents make me too independent." right? So the sooner that we can start working on that independence. So, that number that you came up with, 45% of having a failure to launch or a slow launch. What do you think is so different about the world today that seems like just a huge number? I wouldn't have even thought it'd be beyond single digits.
No, it's huge. It's huge. Remember, it's define your differently. So you can have people who they go out and they launch and then they get fired and they fail and they come back home. So it's kind of like tail between the legs situation. Or you have pre-launch, young adults where like they are living at home and getting financial help, but they're saving off enough money to go to med school or to go to grad school or to get that job or to make that move. So there's different stages of this, first of all. But I would honestly put two reasons as to why I think we're in the position that we're in. One is the lack of practice, and overcompensation by parents. We kind of call them like snowplow parents or snowplow parenting, right? The snow, the parent is the snowplow. The snow is adversity in life. And instead of letting the kid figure out how to manage and get around adversity, the parent comes in first and foremost and plows it out of the way so they don't have to deal with it. So they're not getting a lot of practice using like distress tolerance skills, developing realistic goals. I mean, I literally have had patients in the past say to me, I want to be queen of the world. And they're 16. I'm like, well, there is no such thing. Like there's no queen of the world, like maybe queen of England, but like, now she doesn't do as much as she did in, the 40s and 50s. And it's not really like queen of the entire country. And they really don't know these things. And these are smart kids. I mean, we're coming from the DMV area, the Washington, D.C. area, and we're one of the top areas in the country for education and competitiveness. And these are some of the goals that these kids have. So I think, really not doing that. And then also I think technology is a big piece because technology hasn't, number one, given young adults enough real life experience, like, trial and error. I tried to talk to this person. I interviewed with this person person to person, face to face, and it didn't work. And I'm going to learn from there. I'm going to learn about the nuances of nonverbal interactions versus just verbal interactions. So I think that's kind of prevented us from getting as much practice. And I think also it's given us a sense of like immediate gratification that if I want something, I can get something right away. And when you're working really hard at a job, it may take months or years to get that promotion. And you're not going to get an A++ thumbs up from your boss every 5 minutes. There's no such thing as that anymore. And that's something that in this kind of immediate gratification culture, they're not used to and they haven't adjusted to or adapted to. And it's not that you've got to do that after you get the job. You've got to do that before you get the job so you can be successful in it. So I think those are kind of, those two main concerns are kind of in terms of like what I have seen, I think are the biggest um, contributory factors to the situation that we're in now in terms of failure to launch.
Now, if someone suffers with anxiety, let's say they're out in public, they're having a feeling an anxiety attack come on. Is there a quick tip, something in less than 60 seconds that they can do to stop the process, get control of their thoughts?
Well, first of all, you've got to let go of control. It's not about getting control. It's about letting go of control. And so what I do is I tell people, think of it's a game that kids play where you get your fingers stuck in it, right? I think it's the Chinese finger trap. And the more you go in and the more you're like, get me out, get me out, get me out, get me out, what happens? You get stuck in it. But if you relax into it, you pull right out. And so that's the biggest metaphor, I think, that really encompasses a lot of the exposure-based therapies that we do for anxiety. So it's really about diving in. Imagine that panic attack, that anxiety experience is a pool. You're not just going to wade around the end. You're going to dive into it. You're going to let yourself experience that water. Your body is going to have to be in that water long enough to realize that you're not in danger. And that's what's happening is your body's saying, oh, wait, there's a saber tiger around the corner. But in reality, you're just sitting in your classroom. And so our bodies do one of two things. It scans, like we're literally visually scanning our environment, looking for that threat. Or we'll say, it must be where I'm at, or something's wrong with me. And that's where we want you to relearn, like what's called unconditional safety.
I love it. I'm going to take just a moment and go to our sponsor, which is bettercoffeeshop.com, the world's best organic coffee. infused with reishi mushroom, which, by the way, is really good for GABA. That's going to be calm. Serotonin, which is happy. Acetylcholine, which is memory. And dopamine, which is focus. And by the way, we even have a royal brew, which has reishi, cordyceps, and lion's mane, which can be beyond wonderful for your brain. Bettercoffeeshop.com. Try our one box challenge. So now, interesting question here. Is there a difference between teen anxiety and adult anxiety?
Yes, yes. And there's a difference between child anxiety, preschool age anxiety, teen anxiety, adult anxiety, and older adult anxiety. So I actually did 2 separate residencies way back in the day, one in child and adolescents, and then I did one in adults and geriatric adults. And the biological comorbidities, the development of the brain, the pace of brain development, biological gender differences, things like that, um, they do play a significant role. So yes, I mean, teen anxiety tends to, um, I would say one or the other kind of tends to be more kind of inheritable slash influenced by the family systems dynamic that's going on. So if there's anxiety, chances are one of the parents has anxiety. Um, Not always, but most of the time. And it really depends on how that family system is handling that anxiety. So a lot of times you'll see, especially in teens, kind of an avoidant approach or an indulgent approach. Like we're going to just give the kid whatever they want because we're so afraid of them experiencing panic or anxiety or distress or yelling at us or being upset. And what it tends to do is give a lot of actual positive reinforcement to that anxiety. So that anxiety learns every time I feel this way, I'm going to be rewarded, whether it's externally or internally. And so there's a big component there. And we see less of that family systems component in adults because, hopefully they're off and kind of on their own. But yeah, I mean, and the topics change too as well, areas of concern in life, that moves from, friends to, as you're a teen and friends in school to more family, relationships, jobs as you get to be an adult as well. So it's really, unfortunately, although this makes my job very interesting on a daily basis, sky's the limit. Like there's no one patient, despite having the same disorder, that is alike I've ever had. I never treat the same person twice. So it's very diverse.
Wow. I love how you said that, right? You can't step into the same river twice. So the person's changing moment to moment to moment, but there's got to be some commonality. So if a parent has an anxious teen, what are some of the things they should do and what are some of the things they should avoid?
I would say if you have an anxious teen, it's really important to kind of have honest, open conversations with them about how they're feeling. As parents, I tell parents, like, you'll get a bubbling sensation that comes up from your stomach that you just I always tell parents, like, I describe this feeling. You wanna stop the anxiety for them. You don't want them to experience it. You don't want them to be in pain. And what parents need to do is, at every single opportunity, resist doing that. It is not your job to take care of your kids' anxiety. They will have to do that. You have to be a supportive, unconditional, loving, you know, parent, but you can't jump inside their body and do that. I've had many conversations with my kids about this. I'm upset. Can't you just jump in my body and do it for me? I wish I could. I can't. And that's the really important. We want to teach our kids like they're going to have what's called a self-efficacy, the ability on their own. It's a more important concept than even self-esteem. The ability to know that you have the internal skills that no matter what comes your way, you'll be able to cope with it. And so I tell parents not to do that. Be careful about when you are allowing your kids to avoid situations. Are you allowing them to avoid because you're kind of thinking, oh, they're anxious about it? Or are you avoiding because you're anxious about it? And then are you giving too much reinforcement? How are you giving reinforcement for anxiety? So, and these are things that are really, really difficult as parents. I tell parents all the time, you've got to cut yourself some slack because I'm a parent of two. And if my kids had significant anxiety disorders and needed to see someone, they wouldn't see me. And the reason is, as a parent, it's like you're in the well with your kids. And imagine you're in the well with your kids and I'm at the top of the well and I yell down to you, hey, what does the weather look like? And you look up and you go, oh, it's beautiful and it's sunny. but you don't see that there is a thunderstorm brewing 2 miles in the distance. And that's because your vision is limited, right? You're in it with your kids. Now, while your vision is limited, it also makes you the expert in your kids. You're the number one expert. So I tell parents all the time, I'll maybe be the expert in anxiety, but you're the expert in your kid. And that's where you and I come together. And that's sometimes what it makes it really difficult for us to make these judgments as parents, because we're making it with like a limited scope, a limited vision. And that's why you need to bring someone like me in, from the outside.
Wow. You know why that one? I can't believe that our 30 minutes is already gone, which is our magic recording time. But if you have one tip to share with the audience, what would that be?
I would say don't be afraid to reach out for help on the system. I mean, reach out to the right person, do your research, for anxiety in particular and depression. You want an evidence-based clinician who does evidence-based work. I'm big on evidence-based. And for anxiety and depression, that's cognitive behavioral therapy, specifically with exposure therapy. That's very important to ask, because a lot of clinicians say they do it, but they do what we would term like a diet version or a light version. But don't be afraid to ask for help, because if you ask for help earlier, we're in treatment maybe 2 or 3 weeks, 8 sessions. But if you keep waiting, it makes the time that you're in treatment every single week that you wait even longer, exponentially longer. So, and there's nothing wrong with it. But you'll get someone who's kind and modest and very informed and who really wants to truly help your child.
Beautiful. And if they want to buy your book, how do they find it?
It's on Amazon right now. It's just Illness Anxiety, Dr. Kaplan, and Dr. Warden. I read there's a woman on the front who is bending over like this. It's purple. So yeah, it's right on Amazon right now. And then I sent you the link as well for the Life Prep program.
Beautiful. All right. Well, what a wonderful talk about brain, life, health, creating all that we want. None of us are as smart as all of us. None of us are as strong as all of us. So how wonderful to have you and your team of 9 and expanding, making mental health so much better. I certainly appreciate you. And as always, I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful.